The sort of arc of your symptoms, if you like, over this 6 months, has it been a plateau? Has it been steadily worsening? Is it more frequent, or is it just...
It's been steadily worsening.
Yeah.
Like the past couple of weeks, it's actually moved now onto my left side. So when I'm hobbling now, it's, you know, it's not like I can put my weight onto one side. So it's becoming a real problem.
Okay, great. So, I mean, I think sort of in summary then, we've got a 6-month history of, you know, potentially hip joint sounding symptoms with probably a little bit of muscular pain going on around them. It's obviously, you know, maybe not really had much treatment to it so far, which is helpful to know because it gives us the options that we can sort of lay out when we sort of get to the point of trying to figure out what's going on.
Does that 6 month coincide with your marathon training, or is it different?
No. So the groin pain, that came on with when I started running, but the side of my leg and the hip pain, you know, moving my leg over, that's been like since the summertime, you know, way before I was starting running.
Yeah. John, there's a couple of questions coming from the audience here. Lawrence has said, does the type of footwear make a difference? Now, I don't know whether it does or not, but is it the sort of question that you'd find would be relevant?
I don't ask that sort of thing, if I'm honest, and you know, I don't think that's necessarily a bad question to ask people when you're looking for modifiable factors, really, for sort of recurrent pain, particularly during exercise. But I guess I don't think that widely about these things often. I'm sort of very focused in on what I think is I'm looking really for a structural problem or not a structural problem, and so that I try and keep my focus very much on the hip joint.
Right. And Vicky's asked whether you've had any falls off your bike.
I have. When was that? Christmas 2022. So
quite a while back, before this all started.
Yeah. Way before.
But I think you said before we came on air, one of the things you were desperately worried about was a stress fracture, wasn't it?
Indeed, yeah. But the side that I landed on was my left side.
Right.
And I had X-rays at the time because the pain was, you know, that bad. I thought I'd broke my pelvis, you know.